Good afternoon, ladies and gentlemen, and welcome to this program, You and Health, aired on Equinoxe Radio, Multimedia, and for presentation, I am Monsieur Lucy Liengo. Around 4 million people in Cameroon are affected by schistosomiasis, especially in areas with freshwater bodies. Today we'll be discussing on some of the causes and symptoms, why not preventive measures which we can take in order to curb the spread of this disease. With me here in the studio is our special guest. But before introducing our guest, here is my co-host, Immaculate Foge. Good afternoon.
Good afternoon to you, Lucy. Good afternoon to you, Doctor. Good afternoon to our millions of televiewers and listeners of Equinoxe Television. It's always a pleasure being with you all.
And our guest for today is no other person than Dr. Ahmed NFOR. He is a public health consultant. Good afternoon to you, Doctor.
Good afternoon, SC. Good afternoon, Immaculate. It's nice being with you again in this wonderful program today.
Always a pleasure.
Sure.
And straight away to our questions, Doctor. Today we are talking about an important topic, which is schistosomiasis. And we want to know, we know that the term is somehow very big for many people to understand. Like
Exactly.
like for a layman understanding, how can we define schistosomiasis?
Okay, schistosomiasis, also known as bilharzia, is an infection which is caused by a group of worms, globally known as blood flukes. They live in the flesh of human beings and causes disease, which we're going to see their signs and symptoms. These worms come from a genus called Schistosoma, and there are two types of them. We have Schistosoma mansoni, and we have Schistosoma japonicum. Those are the two main types which are common in our context in Cameroon.
We are eager to understand what causes this disease.
As I said, the main cause is a trematode. If I want to simplify what we call trematodes, they're a group of organisms that live in snails. Some of them live in snails in high sea, deep freshwater bodies, and they are transmitted through eggs, through feces and urine. We're going to look at it later, but the main cause is the blood fluke.
We somehow know that a disease is being transmitted via freshwater bodies. We would like to understand how it is being transmitted more.
Yes, the schistosomiasis or the schistosoma itself, they have a life cycle, which is mostly carried out in water. We have a type of snails that live in freshwater bodies. It is which harbors this particular pathogen or this particular parasite. And this parasite lays eggs in the snails, and when the eggs are matured, the larva is released into the water bodies. And this larva now can affect those who are swimming in the water bodies, can easily affect those who are swimming in the water bodies, can affect those who drink contaminated water, and can also be transmitted by feces and urine, because when we drink water from these contaminated sources, the intestines are also contaminated, and the bloodstream with these nematodes or trematodes, and can easily pass out through eggs in urine or feces in water bodies.
Now, Doctor, how can we tell someone is suffering with this condition?
There are a lot of signs and symptoms which may come up when somebody is infected with schistosomiasis, with schistosoma. We have high body temperatures. We have an itchy red skin, which is common in some people. You have diarrhea, you have cough, and sometimes you have red rashes all over the body. We equally have muscle and joint pains, which can result from infected persons, which is common. And then we have general sense of unwellness. Sometimes the people, they are sicklers. They all look sick. And then you have frequent headaches and dizziness. These are some of the signs which are common. And then painful and swelling tummy is also common in other infected individuals.
Who is more likely to get contaminated with this? And are these cases very common in Cameroon?
Yeah, schistosomiasis is common in Cameroon, though it's almost getting extinct, but it's still common in some areas of Cameroon, especially the Njombe, Manju, and the western region, where they still put up some high percentages of cases. People who are more exposed to this are people who carry out most activities in water bodies, like fishing, like bathing, like washing of dresses. You will know people who live around the rivers or streams or big water bodies where contamination can be common, Most people pass their time, even those removing sand from the sea. These are activities that is taking place in fresh water. These people are more exposed. But when you look at the context of world spread, about 250 million people live with schistosomiasis. 90% of these are found in sub-Saharan Africa and the African Maghreb, in the northern Africa. But 90% of infection is in sub-Saharan Africa. So Cameroon has a percentage of about 1.7. We are going to look to that, maybe 5.5% infection in Cameroon.
For those who would like to participate in the program, here are the contact: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Those are the numbers you can call and participate in today's program.
Back to you, Doctor. How can schistosomiasis be prevented?
The prevention of schistosoma or schistosomiasis to prevent this parasitic worm requires good hygiene. We have good sanitation. The environment should be very clean. And then secondly, when we already suspect contamination, those water bodies which are suspected to be contaminated with schistosoma, water from those sources should be boiled, and boiled for at least 2, 3 to 5 minutes before drinking. Secondly, those who are bathed in such contaminated water bodies should clean up themselves with a towel and make themselves dry, because this will make the spore not to survive on dry bodies. Another means to also prevent is adding chlorine from water carried from these bodies, because chlorine inhibits the multiplication of spore or sporulation by this parasitic worm. There are other methods that we could do prevent is by also avoiding seafood which we suspect must have been contaminated with the eggs. We can avoid, or we have to cook them well before eating to make sure the eggs are destroyed. These are done only when there is a suspicion that is contamination. It's not as if every water body has schistosoma. It is when there is an outbreak or when there is a rumor that is the water bodies are contaminated. And then we are equally advising that in cases where there is an outbreak, people who do most of their laundry around water bodies, like washing their dresses, swimming, small children, they have to avoid that. They could carry the water home, try to boil them before using them, before drinking them.
And now, Doctor, we would like to understand. We know that the Ministry of Health is launching a campaign that will start from the 27th to the 2nd of December concerning we have this tropical disease that have been neglected, and this campaign concerns children from the age of 5 to 14. Exactly. We are talking about a deworming campaign. How related is this to schistosomiasis?
Okay, exactly. You are coming to a very pertinent point. Schistosomiasis is classified under public health studies as neglected tropical disease. Those are things we live with them, but they have been neglected because we think they are gone, but they are there. And they are threats like schistosomiasis, like onchocerciasis, like trichomoniasis, like leprosy, like filariasis, like elephantiasis. Most of these are neglected tropical infections. They are there. I think carry out a campaign and awareness of these neglected tropical infection or tropical diseases are very, very important, because people think they are not there. At the royal level, we know this schistosomiasis is also known as a disease for the poor. You will not see people like, when you look at the world classification, America does not have it. So you realize that it is mostly found in royal environment where people live very unhygienic, in very hygienic environments. So I think what the campaign the ministry is carrying out is very, very important and primordial to educate the royal population on good sanitation and hygiene. Because with good sanitation and hygiene, schistosomiasis and even cholera outbreak that we're already getting signals from the north can completely be eliminated, because they will not spread, because people already have the barriers where they can put to break the pathogen from spreading.
How then can the disease be diagnosed in a country?
Basically, the X of schistosomiasis or schistosoma is found mostly in urine and feces and blood. So to carry a diagnosis, you need to get samples of blood, samples of urine, and you also carry out a blood test. At this level, you can detect the larval stage of the organism, which is a worm. After diagnosis, proper treatment can be done.
Can someone be like completely cured from this condition?
Completely cured, very possible. Schistosoma, as I said, those two types, especially Manzoni, which is common with us, are just like other worms. The difference is that the side effects of their infection are more catastrophic and more destroying to the body system, but we live with worms. So it's completely, you can cure it out.
What are your treatment options?
We have, first, as we are giving treatment, we also prescribe good hygiene.
Okay.
Yes, we prescribe, there is what we call praziquantel. It's a drug which is has been highly recommended by World Health Organization, which is very effective at eliminating this pathogen from blood. And so this is the most common drug which is used, while also educating and implementing hygiene conditions.
What are some long-term effects of this condition if it's not treated early enough?
Yes, when people live with a long time without treating these complications, it can lead to so many things. It can lead to anemia. You can have blood shortage. It can lead to fatty liver.
Wow.
You have people with very large liver. It comes from these long-term problems. We have stomach pains. There are some people who have swollen stomach and they have stomach pains all their life because of this. And then we have miscarriages. It's also common. It has also been noticed that those who live with schistosomiasis, especially the females, who when they are pregnant, there are chances that there are almost 70% chances that they can miscarriage when they are living with schistosoma. Then you also have, when it is not treated with some time, you start having blood in urine. When you urinate, you see blood in your urine, and also difficulties in urinating. And when you urinate, you also have it painful. This comes as a result of chronic untreated schistosomiasis. And then you have blood in feces as well. That's why we have been educating most patients. Blood in feces may indicate 3 or 4 things, but schistosoma is one. It could be internal piles, as well as it could be an inflammation of the rectum. But in the case where this blood comes down, in the case when you are infected with schistosoma, then that blood flow in the feces or urine is caused by this. These are long-term effects if they are allowed untreated. If you look at most of the cases, they have swollen stomach. And the stomach is like their pump, is a balloon. And it's very painful. It makes it difficult for them to even breathe or swallow.
Okay, aside this, what are some of the other conditions that are related to this disease?
That can lead to this disease?
Or that are related? Okay,
that are related. When you look at the manifestation, as I said, the signs and symptoms of schistosomiasis, you realize that since they are trematodes, they are worms, their signs and symptoms are related to tapeworms. And when you look at their shapes, microscopically, they look like tapeworms. The tapeworms may have tentacles just at the end, but at the end of this body surface, while schistosoma have tentacles sometime around the mid part of the body. They look very identical, so those who do analysis in the lab, they have to be very careful because they are very similar. The tapeworm and schistosoma, they are similar. Though the 3 types, Manzoni and the other type, they may be different in shape, but they are very closely related to tapeworm.
Just let me give out the numbers before I give out the next question. Let me still give out the numbers for those who were unable to take it. 670 5470 49. I repeat, 670 5470 49 or 656 622222. Those are the numbers you can call and participate in today's edition of the program.
Back to you, Doctor. The condition, it might be difficult to manage in endemic areas. So what are some of the challenges you face in managing this disease?
Yeah, really, when you come to areas which are endemic, when we say endemic, there are areas that the disease is always there and very difficult to eradicate. The reason being because of the lifestyle. It's very difficult to manage the lifestyle of an endemic area. As I told you that schistosomiasis is related to poverty disease. Those living in these endemic areas are people whose lifestyle are difficult to be changed. You will not stop them going to water to bed. You will not tell them to boil water from 1st to 31st.
For sure.
It's very difficult.
It's quite difficult.
And then you will not equally tell them they may not have access to purify water using chlorine, as I said. And most of them are not really aware of the signs and symptoms. So sometimes educating them might be a very big task because they think, no, this thing will come and go, and they keep on with their activities. So the mentality of people in the endemic area, especially in sub-Saharan Africa and the royal environment in sub-Saharan Africa, is really a challenge, managing them because of the lifestyle.
Now, do you have any other advice for those watching or someone who is suffering with this condition?
Yes, the advice I will give here is that, as I first of all told you, that when you look at the trace of schistosomiasis in Cameroon, we are between 1.7% to 55.5%. And when you look at the Western region, it marks about 39 point something percent, and the rest of the percentage goes national. And when you look at traces, as also, because these are places where you have streams and rivers. And then when you look at traces in littoral, you could also have some traces in Manju, Njombe, Penja. These are places where there are also rivers, and then farmers also carry out some activities in their water bodies. The advice I want to give here generally is that neglected tropical infections are not things to clown with. They are deadly, as they are not neglected because we take them for granted, and in the long run, we cannot be able to handle them. So I want to encourage that the Ministry of Public Health should keep on with this campaign. Let the rural population be educated. And when they are educated, the healthcare providers in this rural population should keep on educating people, not only about schistosomiasis, but about other neglected tropical diseases, because it's a big challenge. It's a very big challenge because most people even study this in school. If you don't go to the university and do public health or about medical sciences to go to neglected tropical diseases, most of us abandon. It has been abandoned. That's why they say neglected. That's why the World Health classifies as neglected. We neglect it. And the Western world, they are not so worried about neglected tropical infection. Already the name tropical means it's only with us in Africa. Let's say 90-something% is with us in Africa, while, as I mentioned before, some countries like America and some European countries are free of this kind of infection because they are far from poverty. So we want to educate the public that the healthcare providers in the rural environment to do their possible best, have a broad knowledge on this neglected tropical infection, then go back to the masses. I know there's always health campaigns that the ministry is doing to educate the public so that in some short time to come, the community will be well educated health-wise, and then some of these things will be extinct.
Now, we know what's happening up in the Far North region where several people have been infected with cholera. We have above 27 cases. What advice do you have for these people living in this part of the country?
This is another big challenge. Unlike schistosomiasis that may go gradually to kill, cholera kill in few hours or days. You see, it's more deadly because it causes heavy dehydration. And when you dehydrate, 90% of the body is made up of water. Then imagine when you lose 50% of water from your body, you're going to go, because all the organs in the body will stand still. Advice number one, at any time you get that there's an outbreak, especially cholera, there's an outbreak, the first thing is to practice good hygienic condition. Don't think it is far from you because you buy fruit from the market. You greet people on the roadside. These people, people are asymptomatic. There are some people who are already contaminated with the bacteria, but it's not manifesting. They are asymptomatic. So immediately you hear an outbreak in an area, even us in Douala, we are not safe.
For sure.
We need to start practicing hygiene because it just takes some hours for bacteria to flew from Maragarwa or from any part of the country to reach Douala, because all food influx is in Douala. So it can be transmitted by food, poor hygienic conditions. So I'm advising those in the Far North, practice good hygiene. Boil water before drinking. Make sure your children, as they're going to school, they should not buy anything which is in liquid form. Prepare their food, put in their bags. No more drinking yaourt and folere or ginger. For now, until the outbreak is over. For now.
Thank you very much, Dr. Ahmed NFOR, for honoring our invitation.
The honor is mine.
Thank you. And sure, ladies and gentlemen, our guest for today was Dr. Ahmed NFOR. He is a public health consultant, and equally my co-host was Immaculate Fogwe, or is Immaculate Fogwe. Thank you, it was a pleasure.
It was a pleasure being here, Lucy.
And of course, for presentation, I have been Lucy Liengu. At the technical dashboard, we had Bertrand Bonzini and Jonathan Babiola. Ladies and gentlemen, we live in the company of interesting programs on Equinoxe Radio and television. Meantime, we'll meet again next week, Thursday.